Good morning, everybody, and welcome. If you're just joining us, if you would please place yourself on mute, we'd appreciate that. If you have any questions throughout the day and throughout the event, please make sure that you put it into the chat box and that you are chatting to everyone. On your screen now is the agenda for the day. As you see, it's quite ambitious, and we've got an awful lot of wonderful things to share with you. One of the first things that you're going to be able to do in just a few moments is take a poll. There's going to be two polls. Both of them are asking the same question. I want to help bring racial equity to the homeless system of care by working on. And you'll see your 14 selections. The first poll will be for 1 through 7. If you would like to work on 1 through 7, then you would want to score and take poll 1. Poll 2 will be 8 through 14. Therefore, if the selection that you want to work on is an 8 through 14, you want to take poll 2. We want to give you just a few moments to go ahead and look over this, and then the polls will be up for you to select. And this is very important for you to take part of this poll. As you saw on the agenda, we will be breaking into small groups. So this is how you're going to be broken into your group, is based on your selection. Thank you and welcome.
So the poll has now launched. Again, if you want to work through any of 1 through 7, please select one of these options. If you are going to be working on anything from 8 through 14, please wait a moment and we'll relaunch the poll with the options for 8 through 14. Please remember to select only one option out of the 14. Thank you. We're going to give about 30 more seconds for options 1 through 7. So we're going to close this first poll with options 1 through 7. Thank you all for who's voting. We're going to open now. 1 second. Give me 1 second. Avery, I'm going to need 1 second. I need to enter Zoom. We're going to be launching the second poll, which is options 8 through 14. So if you did not select 1 through 7, please select one of these from 8 through 14. Again, please do not vote for 2. So we're gonna go for about 20 more seconds on this one. If you have not selected an option, please select. Okay, we're gonna go ahead and close the poll in 5 seconds. If you haven't, please make your final selections. Thank you, everyone. We've now closed the poll. Avery, I'm gonna pass it back over to you.
Thank you. Everyone, I want to introduce myself very briefly. My name is Avery Sliker, and I am the Performance Improvement Manager with the Homeless Leadership Alliance of Pinellas. I have the extreme pleasure of introducing to you this morning our CEO, Ms. Amy Foster. Amy.
Thanks, everybody. And I just want to welcome you to the session today. We're so excited to see so many providers that work in our homeless space here in Pinellas County, as well as funders, government officials, and others. But it's also nice to see the interest from our community and lots of new faces and names that are a part of the meeting today. So I'm going to start off and just ground us for a moment in our equity statement. It's a almost 2-page document and includes a number of items of how we will hold ourselves accountable to that. Avery's going to share the full statement in the chat for you. But this work that we are doing in the continuum of care around equity has been a multi-year process. There's a diversity, equity, and inclusion committee, which you're going to hear from later this morning. And they've been working to draft a statement for us for many years, and it was finally finalized in January of 2020. And I just wanted to highlight a few of the top level points on this that regardless of whether you're a client, provider, stakeholder, member, employer, volunteer, that we want to make sure you feel valued and respected from whatever place you're coming from, and that we are committed to a non-discriminatory approach that provides equal opportunity for housing, services, employment, and advancement, and that we want to make sure all voices are valued and heard in the continuum of care. And then lastly, because we are an organization as well as a system, we want to make sure that as the organization that helps coordinate the system's work, that we are modeling that through diversity, equity, and inclusion throughout the entire system, and maintaining an inclusive environment with equitable treatment for all. So Avery, if you want to go 2 slides. One more, thank you. So since we have so many new faces that are here for the event today, I thought I would just do a quick overview. Many people aren't familiar that the Homeless Leadership Alliance of Pinellas is a continuum of care. And what does that exactly mean? There's lots of things that we do. And the best way for me to describe what a continuum of care is that it's not only a program, but also a structure. So we're going to go through both parts of that quickly this morning. And the end result of that is that homelessness is rare, brief, and a one-time experience. Go ahead to the next slide, Avery. So there's multiple components to the continuum of care, and this isn't represented just by the Homeless Leadership Alliance. There's lots of providers, those who are on the call today and many who aren't, who are represented with these 5 components here. In order to effectively house people, there are a number of different ways that we do that. So we have outreach that you may have heard of, street outreach, where people meet folks on the street who need assistance. And then there's something called coordinated entry, which ensures that we have one standard process for people coming in to receive assistance and how we assess them and refer them. We also have prevention and diversion, which is a really important component of our system. The whole idea behind that is keeping people from coming into the system and experiencing the trauma that goes along with that. You're probably most familiar with emergency shelter. And then our housing solutions include rapid rehousing and permanent supportive housing. Next slide. So what about the structure of the continuum of care? The structure includes representatives and relevant organizations within Pinellas, and the continuum of care appoints a board, an HMIS lead agency, and a collaborative applicant. Next slide. So later today, the chair of the Continuum of Care is going to talk to you about ways that you can get involved. So I thought it would be good for you to see that there are a number of different representatives on the Continuum of Care. There's seats that are elected from the membership, and this gives you an overview of the types of seats that are required by HUD. So we have to have faith-based people, healthcare people. We have to make sure we're hearing the voice of those who've been formerly homeless or who are currently homeless, housing authorities, our funders, providers, and others. Next slide. Then we also have appointed seats, which are made up from our local jurisdictions. So you can see that many of our larger communities in Pinellas County are represented here, as well as others like the Juvenile Welfare Board, our school system, the sheriff, and our public defender. So what is it that we actually do at the Continuum of Care? There's a variety of things that we do. We develop written standards for how shelter and other housing providers should perform throughout the community. Along with our providers and the COC board, we develop what those policies should look like for all of the providers in the system. We also establish performance expectations and manage and monitor programs. We conduct the HUD grant process, and just to give you a sense of the dollars that come into our community around that, in 2016, we had about $3.9 million coming into the system. And right now we have 4.7 million coming into the system. Those dollars don't come directly to the HLA, but we conduct that grant process, and then the recipients of that are contracted with HUD, and we help manage and monitor their programs. We also provide training and technical assistance, as well as conducting advocacy and outreach, as well as strategic planning. Next slide. We report to local, state, and federal entities. We administer HMIS, which stands for the Homeless Management Information System. That's kind of like a database where everybody that is being helped in the system has their personal protected information so that providers can coordinate their care. I talked a little bit earlier about coordinated entry and prevention and diversion, and those are also a part of the portfolio of services of what we do at the Homeless Leadership Alliance. Next slide, Avery. So the last thing I want to end on is how we hold ourselves accountable as a community, and this will come into play when Dr. Patterson presents her survey results later. But I think it's really important that we think about as a community how we are accountable to the clients that we're serving. So in order for us to draw down the funding from HUD, we have to report out some of the variables that you see on your screen right now. So the number of homeless persons, and we want that to be reducing in our community, not going up. We want to show that people have increased their income growth, whether that's earned income or connection to mainstream benefits like Medicaid or other benefits that are available to folks. The length of time homeless, as well as recidivism. So that's if people are coming back into the system that have been in the system before. Next slide. And these are our last four measures. So how many people are becoming homeless for the very first time, whether there is successful placement into housing from street outreach or successful placement in permanent housing, and also that retention of permanent housing. So all of these things make up the things that we are measuring for our entire community to ensure that we are being successful with the system that we have put in place and are coordinating. I see that someone has a question about veterans and their families in the COC. Right now, we don't have a veteran representative on the board. We have in the past. We will be looking for somebody in the next year. So if you know somebody, I'll put my information in the chat, and I hope you'll share that information with us. I can tell you that our largest veteran provider in the community is St. Vincent de Paul through their programs. Next, I'm going to introduce the folks who make it possible for us to be here today. I can't say how thankful we are to the Foundation for a Healthy St. Petersburg, who not only helped fund the study you're going to hear about today, but who also is doing the heavy lifting throughout our community in a number of different systems, not just in the housing system, to help ensure that we have equity across Pinellas County and particularly in St. Petersburg. And they're here today not only as a funder, but also as support to make the presentation go off smoothly and facilitate some of our conversations in the breakout rooms. We couldn't be more thankful for their support. So I'm going to introduce Mr. Carl Lavender next.
There we go. The old line, you're muted, you're muted, you're muted. Hello, everyone, and good morning to you. Amy, thank you for that terrific framing of this very important day. There's much to do, much to discuss, but we cannot begin that discussion without the correct framing. Again, and thank you for that. For those of you who don't know me, my name is Carl Lavender, and I am the Chief Equity Officer at the Foundation. And on behalf of Randy Russell, our President and CEO, and on behalf of Dr. Keturah Jenkins Hall, our board chair, this day, this moment is important to the Foundation. And as Amy alluded, we have a number of ways that we encounter or at least experience what you're experiencing, primarily through data collection. Therefore, today's reveal of data is an important part of what the Foundation anchors its work on. We trust that the wisdom is in the community, and the confidence of our work is in the data. So we are data-driven and we are race equity-driven. The two of those things come together today in an important way. I want to thank our staff that are helping to facilitate today: Carmen Price, Marcus Brooks, and Julie Rocco. Again, Amy Foster, to your team, we are grateful for your work and your sacrifice, your continual sacrifice to ensure that this incredibly complicated arrangement called homelessness is resolved. Ladies and gentlemen, have a great day. Look forward to hearing deep, deep thoughts from you. Great.
Thank you so much, Carl. I greatly appreciate that. And with that, I want to welcome our co-chair from our Diversity, Equity, and Inclusion Committee, Dr. Stephanie Reed.
Good morning. I bring you greetings on behalf of the Diversity, Equity, and Inclusion Committee. And I am the Vice Chair, as Avery mentioned. I want to tell you a little bit about the Diversity, Equity, and Inclusion Committee. We provide insight and advice into promoting diversity, equity, and inclusion in the Pinellas continuum of care. We also develop strategies for board consideration that foster greater participation and make the COC more accommodating and reflective of members from diverse backgrounds, perspectives, and abilities. The committee also ensures collaboration and coordination of diversity, equity, and inclusion efforts throughout the COC. The objectives of the committee are to reduce and eliminate the disparities among people of color who experience or are at risk of homelessness in Pinellas County. We ensure the COC board membership is reflective of the population being served by the homeless prevention and response system, and we establish measurable objectives to reduce and eradicate racial disparities among populations who experience or are at risk of homelessness in Pinellas County. To give you a little background on this study, in 2019, the DEI committee examined the HMIS data on individuals served by the Pinellas Continuum of Care. The committee specifically examined the racial disparities among those served that were evident when compared to Pinellas County population data. The committee recommended to the board that a study be conducted to understand the contributors to these disparities and the specific experiences of Black and Brown individuals being made homeless in Pinellas as a first step in understanding how to eliminate these disparities in our continuum of care. Dr. Susie Patterson and her consulting firm Collaborators Consulting Group was chosen to conduct this study, and it is my pleasure to introduce Dr. Patterson. Dr. Patterson is an applied researcher committed to using her knowledge and skills to help strengthen community initiatives and organizational practices. She received her PhD in community well-being from the University of Miami. Susie has been involved in community-based research and evaluation projects with various nonprofits and social change organizations throughout Massachusetts and Miami-Dade County. Her methodological toolbox includes both quantitative and qualitative methodologies, and she uses a social network perspective in her work with community organizations and coalitions. And now, Dr. Patterson.
Thank you, everyone, for being here today and being interested in hearing about this study. I'm excited to be able to present the results of the study that's been conducted over the past 7 months now, I would say. And yeah, we'll get started. So we can go to the next slide. So just for a brief outline of what we're going to be talking about today, I'm going to give a little bit of background on some of the stuff that Dr. Reed just talked about, the HMIS data that shows, and the HUD data that shows what those disparities are and what kind of led to this study. Then I'll talk a little bit about the methodology that was used in conducting the study, the participant demographics of the people that were interviewed for the study, some of the major themes that came out of that qualitative data, along with some of the more quantitative numbers that were found throughout the study, and then some of the recommendations. And then after that, I believe we're going to be breaking so that we can all talk about those recommendations and think about action steps to move forward. So we can go to the next slide. So just looking at the numbers from Pinellas County, if we look at the countywide racial demographic data for using the HUD racial equity tool, we can see that 82% of people in Pinellas County are white. It's a majority white county. 10% of people in the county are Black. But if we start looking at the numbers of people who are either in poverty or looking at people who are experiencing homelessness, we can see that those numbers actually go down for white people while the percentage goes up for Black people. About 32% of the county who have people who are experiencing homelessness are Black. We can go to the next slide. And that disparity is even more stark when it comes to families. So about 74% of the families in Pinellas County are white compared to 16% of all families, but about 58% of the people of the families experiencing homelessness in Pinellas County are Black families. So we see that we have a huge disparity here, a huge problem. So, we did a study looking at these numbers, talking to people with families about, what is actually going on. We can go to the next slide. So just a little bit about the methodology. Mostly this study was a qualitative study, really interested in talking to people with lived experience of homelessness, about how they were made homeless, some of their experiences while homeless, and exiting homelessness if they're currently in a program like rapid rehousing or permanent supportive housing, what that looked like from their perspective. So interviews were conducted throughout the county with 37 people with lived experience of homelessness. And, obviously this was conducted during COVID, so we made a lot of different considerations. Originally, the plan was to do focus groups with probably between 8 to 10 people per group, trying to get 50 people, but obviously we had to modify because of COVID and wanted to stay safe. So we did some small group interviews and individual interviews, just really trying to meet people where we're at, because we really have to do that and be flexible during these times, and just generally because people have a lot of things going on. So participants were recruited through various organizations, through word of mouth, through some personal contacts as well, in order to be able to talk to people. A lot of organizations helped with the study, and I really thank them for that. Participants were given a $25 gift card to Publix for their time. And then, conducted some small group interviews, individual interviews. I met people out throughout the county, or if they had access to internet or a computer, talk to them over Zoom as well. Next slide. In addition to talking to people with lived experience of homelessness, I also talked to 3 board members from the continuum of care and 3 funders as well, just to get some broader perspective on that systems level, because we're not just talking about individual change here, we're really focused on system level changes here and what we can do as a system, as a continuum of care in order to change these things. And then some other data sources that were considered was a providers council survey, and a lot of the existing data sources like the HMIS data, the homeless management information system data. The point in time count, which is conducted every year, looked at an analysis that looked at 2016 to 2020 that just came out earlier this year from the county, some data from the St. Pete Police Department, and then also census data as well to look at broad numbers of what's going on. So I just wanted to give you a little bit of an example of some of the questions that I asked to people during the interviews. So I typically start out interviews by asking people to just tell me a little bit about how they came to be in their current situation. Just to get started, to start having more of a informal conversation. I would call these interviews semi-structured. I had questions that I asked to them, but also let people kind of take the conversation wherever it made most sense for them. Some of the other questions I asked were around services. So if they were receiving services, I had a whole list of questions around those, around let's see, like, are you happy with the services you've received? Do you feel like you've been treated with respect? Different questions like that. But then also asking questions more about informal support that people had. So who can you rely on for help? Who can you rely on for money, for emotional support, for a place to stay? Have you ever felt you were treated different while receiving services because of your race, gender, where you're from, or your family status? And then lastly, one of the questions we asked, and I'm going to show some of the answers that people had to this later, is, what do you need that nobody's offered? Or what did you need that would have made your situation better if people had been able to exit out of homelessness currently? We can go to the next slide. So just a little bit about the participant demographics of the people that I spoke to for this study. 25 of the 37 people were Black, 2 identified as American Indian, 1 as Asian, 1 put their race as Hispanic, 3 identified as white, and 5 identified as multiracial. In terms of gender, 17 people identified as female, 19 as male, 1 as non-binary. And then in terms of people identified as Hispanic or Latinx, 6 identified as Hispanic and 31 did not. And these were all self-identified categories. So people were allowed to, there were no, people weren't checking boxes. I was asking people, to just self-identify in a questionnaire, how they, felt they identified on these 3 different categories. We can go to the next slide. So I'm breaking down this study into 3 different questions and themes. So the different questions were around, how, what led to this current, bout of homelessness? How were you made homeless this time? So when talking to people in interviews, people cited multiple different reasons for their current homelessness. This included losing a job during COVID. That was something that a few people said to me. Some people who identified as more chronically homeless, who had been homeless multiple times, had talked about drug use or health issues. A couple people talked about insurance issues, health insurance issues, and because of not being able to pay medical bills, that they couldn't afford housing anymore. A few people talked about being kicked out of housing. Not as many talked about a formal eviction, but people talked about knowing that they were imminently going to be evicted, so they just left, or they were kicked out because of gender identity. Domestic violence was a reason cited by some people in the study as well. Having a breakup and being unable to afford the rent on their own because their partner left, and then they were saddled with the rent and they had to leave their house because of that. And then some people who were re-entering or returning citizens who were leaving prison or county jail and just had no resources and nowhere to go. A lot of people also talked about, so I told you that question earlier where I asked about, people that they could rely on. And I was talking about, outside of formal services, who can you rely on for help? A lot of people said that they didn't have any family support. They didn't have anyone that they could rely on for money, or they had, tapped out those resources or felt they'd tapped out those resources and didn't want to be a burden on anyone in their family, didn't want to be a burden on friends. In addition, people talked about how, their family and friends also were dealing with poverty, that they also had family and friends who had been made homeless. And that because of this, what's called network impoverishment, they didn't have people that they could rely on. There was also, if we're looking at the more of the quantitative data, and I'll show this to you in two charts after this slide, there's disparities between the reason why specifically Black people and white people say they're homeless this time. And I focused on this in this chart because our largest populations in Pinellas County in terms of race are Black and white people. And I'll show that to you in a chart after this. But also another thing that I looked into as well was looking at the HMIS data to see, how long had people lived in the county, and are there differences in race on how long people have lived in the county versus who is being made homeless in the county. So we can look at the next two slides. So in this first slide that came from the point in time count, which is the 2016 through 2020 report that looked at the aggregate data across those 5 years of, why were people, people would answer a question of what led you to be homeless this time? And if we look at the numbers, we see that over this time, more Black than white people report losing a job or financial problems as the main reason they are currently homeless. And that was 47.4% versus 38.9% of white people. I included a couple other numbers here just because these are things that people cite when they think about reasons that people are made homeless. So if we look at jail and prison, we know that we have severe disparities and severe inequities in who is, who is going to prison or jail. In terms of Pinellas County, 5% of Black or African American people who answered the point in time count study said that jail or prison was the reason why they were homeless this time versus 3% of white people. And if we look at alcohol or drug problems as the reason why people said they're homeless this time, I believe it was 11% of white people said that that was the reason they're homeless this time versus 3% of Black or African American people who said this is why they were homeless this time. We can go to the next slide. And so this data came out of the way that I do research is, and a lot of the conversations I have will lead me to look at some of the more quantitative data. So in a conversation that I had with someone in St. Pete specifically, it was a police officer from the PATH program, just kind of mentioned, I was asking, if they had noticed disparities in doing street outreach. And they said, this is something more anecdotal, but, it's something I've noticed that when I'm talking to people on the street, I noticed that a lot more of the Black people that I talk to are saying that they're from St. Pete or they're from Pinellas County originally, compared to white people that say they're coming from other places. So I was like, I'm going to look into the HMIS data and see if there's something to that. And there is. So if we take a look at the HMIS data, Black or African-American people experiencing homelessness report being a lifelong resident at over twice the percentage of white people. So 27% of people who are in the HMIS system are Black and are Black or African-American are lifelong residents of Pinellas County versus 13% of white people. So we see a huge disparity in who's being made homeless and who is from the county based on race. You can go to the next slide. So while people were homeless, I asked a bunch of questions about services and then, just about their experiences using a lot of the services or, what it was like during COVID and being homeless during COVID. So in terms of the questions around services, one of the things that I asked was if people felt their immediate needs were being met and if they felt like they were treated with respect. Most people said that they did feel like their immediate needs were being met through the service providers, and that was in terms of clothing or food or an immediate emergency shelter. And most people said that they also felt that they were treated with respect while receiving these services. One of the things that was very common that people said was that information was unclear a lot of the time about what to do next. So when entering into the shelter or entering into a program, people would ask, okay, I have shelter for tonight, but how do I find a job if someone needed a job? And some of the shelters, some of the services were like, well, we don't really do that here. So we have either a bulletin board over here, or you have to get in contact with this organization. So the onus was very much on the person who was going through a traumatic situation, and they felt like they weren't as supported in that way from some of the organizations. And some people said, I talked to families, I talked to some people that were veterans as well, and talked to single people. And there was seemingly a lot more support for families and veterans. And a lot of the single people that I talked to who were experiencing homelessness currently didn't understand why there weren't as many services for single people seemingly, or they felt like there weren't as many services for them, or they would see other people getting things like gift cards for certain supplies, and they didn't understand why they weren't able to get that stuff as well. I'm going to talk about I'm going to show some of the quotes from some of the interviews on some of the next slides, but a few of the participants felt like they needed to make themselves look more helpless in order to get staff to pay attention to them. And I'll show some of those quotes. And then that finding a job or a career and then transportation were top concerns in interviews for what people were trying to get access to. So we can go to the next slide. So in some of the experiences entering shelters, these were some of the quotes that came out of interviews. So one person said, if you just go down to the shelter, how are you going to explain to me how the lower income South St. Pete veterans aren't here? I got here too, and there was not a single Black person here. This was a person entering into a veterans program that felt that they did not see any Black veterans. And this was also a person of color who was saying this, not understanding why they were seeing a lot more white veterans getting moved through a program than veterans of color. In terms of another person said this when talking about entering a shelter, in order to get to the shelter, you have to go through a liaison, a resource officer. I signed up to be there at Wednesday at a certain hour. I got there late because of transportation and was rejected, even though they were still out there. I was headed on my way, and as I was leaving, two people who happened to be white came up and were like, oh, did we miss check-in? And they got through. I went back in and raised the issue, and the officer pretended like he understood, and the other guy was giving rules and procedures, but the explanation was that there was no more room. So it was filled to capacity. How were people still let in? And somebody else had something similar that they said to me as well about entering a shelter, that, they got there, right after the time. Transportation was an issue in order to be able to even get to the shelter. They had been rushing. And then these were both Black individuals that said this, that they were not allowed in, but they saw that white people who had come after them were able to get in. And that was, something that, people always say, they're like, well, I can't prove that this is, something racist, but the fact that two different people had this experience is absolutely worth mentioning here and something to look at. We can go to the next slide. So I talked a little bit earlier about those interactions with staff and people feeling like they need to be, make themselves seem a little more helpless or more deferential in order to get services. These were some of the things that people said in interviews in terms of interacting with staff. I interacted with providers in a manner that I knew would be pleasing to them, so they would assist me. I guess their steps, but they're guarded with the help. They feel like it's a privilege to be helped, not their responsibility. They ask you to jump through hoops I shouldn't have to jump through. One person said about a specific place they stayed, caring about you is not part of the job description. The things that they're supposed to do, probably an A+, but the things we need aren't in there. Other people said they're not mental health workers. They aren't trained in mental health crisis management, talking about some staff members at one of the organizations as they were going through a mental health crisis. And then, sometimes you have to put your pride aside, but it's about how you motivate yourself and how you take the help you get. As long as I was willing to accept the knowledge they were giving, they're willing to help. So that person had more, they took more of a like, well, I took the initiative, so I was able to get through. But a lot of people said that, they felt like they had to change who they were, change their demeanor in order to get help, that it was kind of like playing a game in terms of being able to get help, even though they, had, like I said, going through a very traumatic situation and not really able to receive services unless they were acting a certain way. Go to the next slide. So in addition, one of the top concerns that people talked about were jobs, and jobs were very related to transportation. All of these systems don't happen in a vacuum. They're all connected in different ways. I called this job concerns, but the jobs are very related to childcare, very related to transportation, and having things work out perfectly. Otherwise, all of these things are precariously balanced and it just falls apart for a lot of people. So one person said, well, it's not just the housing, it's trying to get a job that you can maintain the housing with. It's just getting a job with, especially with how the bus system is working now. So transportation is really hard for people. I asked someone about services used too. That's what I asked. I asked everyone, about the services they used. And then this was one person's reply: what services? They have that place that treats you like an inmate, have that place that puts you outside and tells you to deal with the weather. This is probably the best one, but they don't help you with housing. I need a job. It's not their fault. I can't get a job. And if I do, where is there affordable housing? So when we're thinking about jobs too, not just thinking about, oh, okay, great, someone's placed in a job, they're making minimum wage, because we know that Pinellas County housing is becoming so much more expensive that it is really hard to find affordable housing. It's really hard to find affordable housing closer to transportation. And this was a huge concern for people. It's like, okay, if I find a place, am I gonna be able to get places? I think someone said, I think racial disparities are because employment is hard. I've been searching like for a job like a dog for a bone. I don't know if that's Black or something else, but it's hard. Someone said about another place that they say they help you get a job, but not build a career. So talking about how, okay, you've been placed, you have like some form of employment, but that's not helping you build wealth. That's not helping you build a life. It's really just staying at a stasis instead of being able to actually build those things that are going to help you in the future. And then one person talked about paths, like, is there, about a path forward? There were no paths articulated that led to being employed, let alone housed. So people talked about how immediate needs were being met. That was something that people said, yes, my immediate needs are being met. But if I'm trying to build a future, I'm not really getting the help that I need to be able to build a future through this system. You can go to the next slide. So I've talked about so I asked about biases faced, and I talked about this earlier with some of the things that people said to me, and this came up throughout the interview, but in terms of responses to the question, I just wanted to highlight one of these responses. And I'm going to talk about some of the biases that people talked about when it comes to exiting out of homelessness as well. This quote is not, I just want to say this is not reflective of everyone's experience, obviously, but this was something that a few people kind of alluded to. And some of the things that people were saying. So this person said that they hadn't faced biases in the system of care because it's backed up. There would have to be viable slots. So some people would have to be chosen over others. There would have to be a more comprehensive service delivery system for there to be identifiable biases in it. There would have to be more services available. So this person felt like, because, and this was, one part of this conversation that we were having, that because they felt like, people were operating in silos, these different organizations, it was hard to be like, okay, I need to get a job. And they were like, we don't really do that here. You got to go to this place. That it would have been helpful if there was a path that was articulated. And because of that, the biases were things that they weren't even thinking about. Another answer that someone gave me was that they didn't feel discriminated against largely because of their race, but more because of their status as someone experiencing homelessness, that put them in a new category altogether. Other people did talk about biases, like I talked about earlier, and I'm going to talk about specific racial biases, and I'm going to talk about in a little bit as well. So we can move on to the next slide. So one of the other things that I looked at, and I tried to get this data for the county, but the sheriff's department told me that they weren't able to get me this data. I looked at trespass warnings that were issued specifically in St. Petersburg, because some of the things that came out of interviews were around interactions with the police and police telling people that they need to leave certain areas, or they were issued trespass warnings. A lot of people that I talked to that had experienced street homelessness specifically had been issued a trespass warning at some point in their time staying on the street. One person said, please bother us a lot for certain places we're in, but there really is nowhere for us to go. Where can we go? So we get harassed about being here, sleeping here, trying to sit here. There's a big problem about this. One person had police called on him while leaving his storage unit. So this was his storage unit. Police were called on him and he was taken in, and his bike was left, and his bike ended up getting stolen. So now he lost his access to his transportation. So I want to say about this data that I'm showing right now, that this current data is reported by incident, not by individual. If we look at how many individuals outside of incident that this was going, that were getting trespass warnings, the numbers actually go up for Black people who were issued trespass warnings. So we look at here in St. Petersburg that 36.3% of trespass warnings issued between January 1st, 2019 to October 29th, 2020 were to Black individuals, whereas 59.3% were issued towards white individuals. And I believe the population, and somebody can correct me, of Black residents in St. Petersburg hovers around 22%. So we see a huge disparity there. And like I said, I believe it goes up to 39% for Black individuals if we look at individuals themselves and not reported by incident, because by incident here, people received multiple trespass warnings that are in this data right here. And I can't say whether, I wanted to look at, sometimes you can look at trespass warning data and you can see people's home address that was not included in this data. So I can only see where people were trespassed from. So I can't say that, these are all homeless individuals who received these trespass warnings, but we know that there's a huge link between trespass warnings issued and homelessness, and especially here in St. Pete. So we can go to the next slide. Because COVID obviously is still happening, and I was asking about people's experiences during COVID as well, or just came up in conversation. There were a lot of things that were happening during COVID that people had issues with. So I just want to read some of these quotes that came from people's interviews that are about their experiences of homelessness during COVID. So one person said, in the last 2 weeks, talking about some, service that they called almost every day and sat on hold. The longest I sat on hold was 6 hours, and they still hadn't been able to talk to anybody at that time. Another person said that, COVID is a catch-22 for them. This was a person experiencing health issues. Do you go out and work, or do you stay home and stay alive? So for somebody who had been working in a public-facing job, who was not just a first responder, but maybe working in the restaurant industry, something like that, unable to make income because they're worried about staying alive. This person had children. What do? You're being forced to make an impossible choice. One person said, y'all only open on certain days. You only give out so much. People have children and stuff like that. It's making it hard for people. There's not that many agencies around right now that are helping people because of COVID. They only take people in at certain days and certain times. If you can't make it in at a certain time, you come to this place and they're closed. Now you're stuck without your kids eating or you eating. So COVID has had a big impact, obviously, on agencies and organizations, and thinking about safety concerns for staff and for residents as well. But this is one of those unfortunate unintended consequences of those things happening and shelters closing down. Somebody else talked about staying at a shelter and was telling me about their experience staying at a shelter during COVID. The sleeping positions were horrible. You didn't get a mat or anything. You got a spot in the floor like a parking lot, and it was 2 inches or so from the next person. I could turn and roll over and be in the face of the next guy. This guy next to me is so old and he's hacking up a lung, and I'm like, I don't want to catch coronavirus sleeping next to someone. I believe that this happened last March, that this person was talking about. So in the beginning of the pandemic. We can go to the next slide. So a lot of what people talked about was being forced to make these impossible choices. And these were just some of the quotes that, I think that a lot of the things that have previously been talked about kind of, illuminate that. But I just wanted to, give a few more quotes and, a few more voices that talked about that. It became a matter of time and priority. What's a priority, your mental health or making sure you have a roof over your head because you only have 1 week left? And this is somebody who had been experiencing some serious psychiatric issues that had medication but wasn't able to get access to the medication because of insurance issues. And another person said that, I feel like I'm being asked to choose between living and dying, especially when it came to COVID. We can go to the next slide. So lastly, we talked about how people were made homeless, talked about experiences people had while homeless, and then, I asked people about their experiences in exiting homelessness. So a lot of the people that I talked to, a good amount of people had known about rapid rehousing. They might not have known the program name, but they were either enrolled in rapid rehousing, which gives people access to, they have to go out and look for housing, but they are able to get help paying for 3 months rent, I believe, and somebody can correct me on that knows more about the rapid rehousing program. Rapid rehousing was very valuable for the people who were enrolled in the program and for those fortunate enough to get into the program, and many point to being happy that they were able to get in and get access to a program like this. But at the same time, a lot of it took a really long time. We have shortages of housing, have to think about getting landlords on board to take some of these programs, and people were waiting a long time and are still waiting a long time to get access to more sustainable, safe, affordable housing. So many have given up and sought housing on their own. Some people told me they were able to stay with friends or move in with a family member. A lot of times that was precarious and only short term. And then there was questions about what kind of support exists after being housed. In one small group interview I did when I was asking about, rapid rehousing, because some people said they were in rapid rehousing, this is what one of the people said. They said, when it comes down to us Black girls, they don't help us at all. But the girls that I just named y'all, this person was talking about how they were seeing white individuals moving through and getting housing before Black individuals at this one place. But the girls that I just named y'all, guess what color they are? They're all white and they all got help. Any Black girl that's been here longer than you guys will say the same thing. They just had an incident the other day with a Black girl. She said to staff, "You don't help us." So from this interview, I looked into numbers of rapid rehousing based on race, and we can show the chart on the next, we can show the next chart. So I looked into the rapid rehousing numbers through our HMIS system to see if there were disparities there. And you can look at how long a client has been enrolled in a program and then what their destination is. So I had looked at permanent destinations and temporary destinations. So for permanent destinations of a place for people to live, we see that there are disparities if we're looking at both Black African-American people who identify as Hispanic or in Latinx or non-Hispanic, non-Latinx, that they were in the program for longer than white people who are both Hispanic or non-Hispanic in the program. So for Black African-American people who are Hispanic or Latinx, their average enrollment days in the program were 267 compared to 205 days for Hispanic or Latinx white people. And then if we look at Black and African-American people who identify as non-Hispanic, non-Latinx, they are in the program for 248 days compared to 213 days for white, non-Hispanic, non-Latinx people. So rapid rehousing is also not a permanent solution. It doesn't solve the long-term housing affordability problem, but it is a temporary solution right now. And still, after exiting rapid rehousing, people face high levels of residential instability as well. And that was one of the things that people said. They were really nervous about what was going to happen after the money from rapid rehousing ran out, especially knowing the job concerns that are happening as well. So we can go to the next slide. So like I said in the beginning, one of the things that I asked people is, what is something you need that nobody has ever offered? And I wanted to illuminate some of the things that people said and the voices that of people that I talked to and their answers to this question. These are some of the examples. People talked a lot about not having support or consistent support. So I'll read some of these to you. Just support, that's really it. Just support, help with the kids, me finding jobs, that goes along with the kids. Just support all around. One person said, help, I just need a lot of help. Someone said a path, a viable path. If you do this, more than likely this will happen. They just say, get a job. Okay, now what? And then affordable housing. You know, even if you work a job 40 hours a week, you still struggle. When you're by yourself, it's even harder. Another person said, consistent support, you know, even if it's not financial, if I walk in somewhere and say, I'm bipolar, I can't focus, there needs to be a service that can help walk you through the entire process and help make sure that you're doing it right and people are getting back to you. That's the problem. It's all a waiting game. Another person said emotional support. Nobody's ever just been like, how are you doing? What's going on? Because off the street, if someone was just like, hey, are you okay? I would just break down and cry. And then another person said they don't want to listen to you. No one takes the time to listen to what you want. You can come up with a plan, but they don't listen. People saying, here's what you need, not what do you want. I know what's best for me. And this was something that kind of came out in interviews too, is that, you know, people were happy for the help they received through services, but a lot felt like, you know, a plan was being made for them and they weren't really being empowered to make choices for themselves throughout the process. They were kind of being told, this is what's best for you. No, this is the type of job that you need to get, instead of being able to be like, no, I know what's best for me as a person. So we can go to the next slide. So some of the recommendations coming out of the study is, you know, support was such a big thing that was talked about in all different ways, talking about formal support, talking about informal support. So as a continuum of care, as a community, as Pinellas County, as our communities here, we need to reimagine what support looks like. And this can look like, you know, more formal things like, you know, greater access to mental health services or more mental health training for organizational staff, Maybe eventually there can be a centralized location for getting support services instead of people having to travel throughout the county, especially with how hard it is for people to get access to transportation. But then also having a commitment to community building. A lot of people said they didn't have informal support. They didn't have family support. They didn't have people that they could rely on even to talk to. So what would it look like if, as service providers, as people who have experienced homelessness, as those of us who care deeply about these issues, what would it mean to create a community that supports each other? What would it look like if people going through these services weren't going through alone? If they had other people they could talk to, and that was something that was encouraged. In addition, having access to sustainable jobs and careers. So not just getting, a job that pays the bills temporarily and you're not able to save any money, but what does it look like to actually help people build careers? And some people did have careers and they were still having issues and falling into becoming, being made homeless because housing is just unaffordable, or they were just at the whims of their landlords and the landlord decided that they wanted to sell the house, so they only had a certain amount of time to get out. But having access to sustainable jobs and careers, and one of the things could be building and strengthening relationships as a continuum of care with jobs organizations and making a plan and setting up a viable path. Overall better systems integration and new partnerships. Who's missing from the continuum of care? Which sectors are missing from the continuum of care? Whose voices are being listened to over others? So this isn't just about who's missing, it's also about whose voices are being prioritized when it comes to making recommendations. For example, I don't know how many people on this call have had lived experience of homelessness. Are they here? What's going to happen? Are their voices going to be able to be a part of, making these changes? Because they are the people who have experienced these things firsthand, and they should be prioritized. Strengthening the commitment to advocacy as a continuum of care. I do know that I believe that there's an advocacy committee that has started, but really honing in on areas of advocacy, advocating for more affordable housing. Some things could be, banning the box countywide of, do you have to say that you have gotten a felony and that, on a job application? We know that that disproportionately impacts Black people just overall in this county and nationwide. The eviction moratorium has been extended, but what does that mean for the future? We still don't know. It keeps getting extended and extended, but we don't really know what's going to happen in the future, or as COVID becomes more under control, if that's just going to end. We can go to the next slide. So taking an explicit race equity lens as well. And I know the DEI committee has been doing amazing work, but really thinking about, what does equity really mean? I know that at this point it has become a buzzword. So if we're thinking about, let's not just say equity, let's actually think about what do equitable actions look like. And that's what's great about this call. I'm hoping that, there are going to be some great discussions in some of these breakout groups, talking about what are equitable actions. And then also reimagining what accountability is. A lot of times, this is just how our nonprofit system, how our social service systems are set up, is that accountability a lot of times, even though we can talk about how it's to the people who are served or the people who are most affected by issues, a lot of times organizations feel the pressure of being accountable to funders, which obviously you're getting funding, you have to meet certain metrics, but what if accountability is reimagined to be about people who are most affected by these issues? What if that is how, funding is set up? And that's something to think about more broadly as well. Replacing or amending the VI SPDAT, which is the prioritization tool that gets people into services. So the VI SPDAT as a tool, there's research that has shown it to be ineffectual at reducing racial disparities and who's getting served. I'm sure we can link to that research or send articles if people are interested, and asking, who in our system is being prioritized. And that was, I wasn't able to look at that for the study, but we can kind of see in terms of rapid rehousing, maybe some of those numbers, but that was something that would have to be looked more deeply at. Then expanding access to housing vouchers. So rapid rehousing is a good start. It's a great program. It does work for some people, but it's also not a long-term solution for a lot of people as well. We have to look at, expanding access to housing vouchers, which research shows access to housing vouchers is one of the things that really works to help people exit homelessness. Housing first policies. How do we get people stably housed? And then lastly, looking at more research and evaluation. So strengthening commitment to continuous quality improvement for the continuum of care, taking a look at evaluation data more consistently, every month, an annual revisit of the strategic plan, asking, every organization that's in the continuum of care and the continuum of care itself, how does funding shape the work we do? And what does that mean for us in the work that we do? And then, just an example of something that would be nice to see as one of the first things that is done is a survey to all COC members about their approach to race equity. What current activities are you doing around race equity in your organizations? And how organizations are connecting around these issues? Because a lot of people I talk to, referred to how a lot of these things are happening in silos. They're not able to, if they want a job, they're being told to go here, but those organizations aren't connecting. So really doing some research, maybe a social network analysis to look at how are these organizations connecting around these issues and who is connecting around these issues would be very important. And then you can go to the last slide. So just to reiterate, some of the things, or just to, bring it all to a close here, homelessness is a lagging indicator of other societal problems. I know that there are other initiatives happening in St. Petersburg and in Pinellas County looking at race equity. How do we make programs? How do we make our systems more equitable? And homelessness is a lagging indicator of that. So when we see that there's racial inequities, if we see that there are racial disparities in homelessness, it's because we have disparities in our other systems as well. So prevention and coalition building is key. We need to work together throughout all of our systems with people with lived experience, having people with lived experience helping to lead these efforts, and being compensated for leading those efforts is going to be extremely important. So thank you very much.
Thank you so much, Susie. Dr. Patterson, thank you for being with us today. It's my extreme honor to introduce to you all now Jeffrey Lorick. He's the Director of the Office of Human Rights with Pinellas County Government and a very dedicated member of the Diversity, Equity, and Inclusion Work Plan. Jeffrey.
Thank you, Avery, and thank you, Dr. Patterson. Wow, how do you go after a presentation like that? I feel like we almost need to just sit and marinate in it in a minute. And I could see from the chat that there's a lot of conversations around this topic. So great discussion. So my role today is, as a member of the Diversity and Equity Inclusion Committee, is to talk about our development of a work plan. And to develop this work plan, we use this buzzword that's out there, an equity lens. Well, what does that mean? It means paying disciplined attention to race and ethnicity by analyzing the problems and looking for solutions and defining success, which is our goal. We have a visual presentation that we'll cover a little bit more in detail in a few minutes. But the work plan has been developed using frameworks that essentially have 4 focus areas, which is research, advice, implementation, and evaluation. This committee has created a 3 to 5 year rolling plan that reinforces the COC's committee's use of the equitable lens. The plan discusses actions the committee will take proactively combating racism to achieve inclusion and access, diversity, multiculturalism, and intercultural exchange. The work plan creates avenues for input, feedback, and dialogue on developing strategy, initiatives, and programs. Through this plan, the committee will develop a common language, a focus on culture and accountability and inclusive issues. So bringing your attention to the diagram that is on the screen now, will emphasize those focus areas. One, the COC's evaluation system. The COC looks at a lot of data and then evaluate it. And some of that data comes from the HMIS system, school data evaluations, our point in time, which is our PIC count, and then setting standards of evaluation and developing monitoring tools and client surveys, all really important. Then there are the area of formal studies as part of what we had just a few minutes ago, that you look at racial disparities, that you look at racial composition studies, comparison studies, and then you look at social networks analysis, which is what the Diversity and Equity Committee does. We listen to our stakeholders' input. We identify from those focus groups several and serve on equity committees. We can collaborate with non-traditional providers. We review policies and procedures. Part of the COC policy of being audited, the COC being a board having diversity policies and developing those policies, leadership opportunities, overcoming language barriers. That's something that we haven't heard about inside of this community on persons with disabilities, which would amplify some of the concerns. Services based on data analysis, programming, community awareness events, educational campaigns, publications, landlord incentives, and looking at this COVID environment to try to target prevention. Then there's the training component of the COC, which consists of workshops, creating opportunities to train the trainer, to maintain local trainer lists for various areas and focus groups, and invoke and encourage courageous conversation, which is what is taking place today in the chat room. And so to conclude, each of these have objectives, goals, action steps, primary stewardship, the needed resources, needed partnerships, and targets completion dates. So it's not an ongoing, we want to be able to bring it to a resolution in a specific period of time. This plan allows the committee to identify measurable indicators, to establish accountability mechanisms, and report to the COC board about successes and lessons learned. So thank you for giving me this opportunity to share our goals as an equity committee and our work plan strategy as we move forward through this difficult environment of homelessness. Appreciate the time. Thank you, Avery.
Thank you, Jeffrey. Thank you very much. Now's the time that we are coming to question and answers. And due to the large number that we have today with us, we're going to ask for you to put your questions into the chat box if you have not already. Amy, myself, and other HLA staff have been monitoring it, and we have got our questions here. Please feel free to post questions for Dr. Patterson and for the committee.
Avery, while we're waiting for folks to put some questions in the chat box, I was able to gather some from earlier. I think a couple people would like to hear a little bit more from Dr. Patterson on demographics of the group that was interviewed, whether any families, single parents with children were interviewed. Were we able to interview vets? So any kind of demographical data that she can share, that was one of the things that folks were interested in hearing more about.
Yeah, sure. So there were single parents that were interviewed who were currently taking care of their children. There were also people who were interviewed who had children, were single, but did not have custody of their children at the time. There were a few vets who were interviewed. I think that there should be probably more research done into veterans. There were some people that felt like they had access to a lot of stuff as veterans. Some people who, one person pointed out, I had a quote in there about someone saying they noticed as a veteran going through services that there weren't as many Black veterans that they saw in the program that they were in, and they were wondering about that. They're like, why are, it seems like white veterans are being prioritized. That was one of the quotes from someone. But yeah, there were, I didn't capture those numbers in the demographics questionnaire, but I could go back into the interviews where people kind of just talked about their experiences and who they were. But both of those groups were in there. I don't know if there are any other specific groups that people were interested in hearing more about.
Thanks, Dr.
Dr.
Patterson.
Patterson? One of the questions that we have here is, are there any examples in the country that are successfully handling the homeless population? Did you come across anything within your study?
I think that every system is having issues right now. I think some of the more successful examples that we see are probably up in Canada. I know that there has been some great research in Ottawa and specifically, but I'm not sure domestically, nationwide, if there have been any examples. And that wasn't something that I was really looking at more specifically, but it would be something interesting to see. I know that Canada has, really adopted housing first nationwide as the policy, and that has been, I think, fairly successful. I mean, obviously, these are huge issues, and that there's a lot of other systems that need to be thought about when thinking about homelessness, and how are we all working together to work on these issues. But I think there's been some success up there.
Avery, there's been a couple of questions that have come in that are probably more for me than Dr. Patterson. So I will go ahead and respond to those. One of the biggest questions that we've talked about at the COC board level is, what are we as the HLA and the continuum of care going to do differently as a result of this study? And we are working very diligently to ensure that this is not a study that sits on a shelf, and there will actually be a work plan that goes along with it, which is what Mr. Lorick presented to you. So we kind of have some ideas about future studies that need to happen, as well as system changes, looking at the VI SPDAT, since we know that there's racial bias baked into that assessment tool, making sure we hear more live voices, looking at how we reduce the length of time that people are remaining homeless, also employing workforce specialists so that we can go to people where they're at instead of sending them somewhere when we know transportation is a problem, that kind of thing. So there's a whole host of things that will come out of this. That work plan that was shown is one example of that. But here today, we're also asking you to help us prioritize that work. So in your small group sessions, you're going to lift up what you think we need to do first as a community, and then we'll work with funders and partners to make that possible. So your voice today and being here really matters, because we want to hear from you what you think the most important thing is we should focus on. The other question that came in that is more for the COC as a whole, that I want to take real quick, is housing first. We did pass a resolution as a continuum of care many years ago that everyone in the COC needs to follow housing first. It's a requirement of HUD. Most of our local funders also require that, and even include a checklist for a housing first barrier checklist. And then people have to explain why they may have a barrier in place and what's causing that, so we can provide technical assistance around that. Can I sit here and tell you today that housing first is fully implemented in all of the organizations that serve our community? Absolutely not. I think there are a number of barriers that we still need to address and overcome. We started with the carrot and stick approach of having funders get on board and help us bring organizations along, but there is still work to be done there, and we'll continue that work.
Thank you so much, Amy. Now, one of the questions that was asked lastly was in regards to tracking the women, veterans, and families. On the HLA website, we do have our data dashboard, and I would encourage everyone to visit that and see what information's out there regards our data. We have a very, very robust HMIS team that puts that data together for you, and it's there for you to use. So please visit it. And again, we will definitely connect some of you with the Veterans Leadership Group.
Avery, there was a question around, and I'm not familiar, but I didn't know if maybe Dr. Patterson is, if there's been any similar studies on race disparity across the state and how our community compares to others. I haven't seen anything, but I wondered if in your lit review or anything else, maybe you knew something, Dr. Patterson.
Not in my lit review, but I used to work on issues around youth homelessness in Miami-Dade County. So I was having some discussions with people out there just about what's been happening. And I know that they had started at least pulling data on that, but they have not done a study like this. They have not done interviews with people or actually captured the voices of people with lived experience. So talking to them out there, they were like, this is the first study that we've heard of in the state of Florida that's actually addressing these issues in this way.
Amy, we've got a question that just came in again about the COC.
Sure. Is it in the chat?
Yes, it's do COC organizations have people with lived experiences of homelessness on their boards? And if so, how are they compensated?
That's a great question, Jackie. So this is something that is monitored in each program's monitor and review. We as the COC have to have folks with lived experience on our board, and so do all of the programs that serve homeless people. I think there's a lot of work to be done around that. As well as I know Teresa commented earlier around the issue that oftentimes those in leadership and those serving on the boards of organizations don't always look like the people that we're serving. And I know that many providers are committed to that work and they need assistance. Something the Foundation for Healthy St. Pete and I just spoke about recently is that we almost need this cadre of folks who we know are activated and ready to get involved. And that's something that we're looking at as an entire community. As it relates to who is compensated, most boards have policies against compensating board members. I can tell you at the HLA, we do provide a small stipend to those sitting on the board who are formerly homeless to assist with transportation or other challenges they may have getting to a meeting. But there's certainly a need for more of that. And that's one of those policy things that may have to be looked at by individual providers and their policies, because it's pretty common that you wouldn't be able to be compensated while sitting on the board.
We do have a question that states, with so many homeless children in schools, how much data was collected to determine if they're receiving the sub-care needed in those demographics? I know that we do have representatives with us today from the school board, and I believe in the chat that they did post a link for us for this data. Please know that we will be posting the recording of this on our website and answers to Q&A, so we'll make sure that that is a part of the post there for Q&A. Dr. Patterson, we have a question of, are you aware of any landmark litigation on behalf of homeless people of color against the system designed to support them?
I personally do not have that information. I do know we have people from the ACLU on the call today, so maybe they can say in the chat if they know of any landmark litigation, but I am not aware of any specifically around homeless people of color.
Thank you. Another question is, with this data, is there a way to measure our progress over the next couple years, or do we have to redo the study?
I guess that's for me. Well, if this had been set up, if this wasn't set up as a longitudinal study, this was set up as a cross-sectional study. So it was just on, what's happening right now, but that's something to think about definitely for the future. Or if we're thinking about evaluation of the services, that can definitely be something that's tracked over time. Like if the COC wanted to do a social network analysis, looking at the relationships between organizations and which organizations are working on race equity issues, or how they identify themselves in terms of working on race equity issues. There are lots of things that could definitely be tracked over time. Just that's not what this study was for. But in some of those numbers, yeah, I mean, definitely some of the numbers from HMIS, I believe and the point in time count are being tracked longitudinally, so you can see the comparison over years. But in terms of the qualitative data right now, no, that's not something that is currently being tracked over time. But I'm sure in the future, if there were future studies done, you can ask similar questions and see if people are having, some of the same things, or if are still being said, or if they believe changes have been made.
Avery, I think some of the other ways that we can address that includes looking at the data that was already presented by Dr. Patterson from HMIS, as she already stated, but we also recently passed a policy for coordinated entry so that we can look at our entries and exits and adjust the numbers of how we are pushing and pulling people in and out of coordinated entry based on race disparities. So that's new work that we are just beginning, but that might be one way that we would see over time if there is a difference being made as well.
Thank you, Amy. We have a question here in regards to, have there been any local studies with the LGBTQ community population, especially with the trans community, as we talk about racial disparity? Susie, are you aware of any local studies?
I'm not aware of any local studies. I'm not sure if any of the other researchers on the call or if anyone from the COC is aware. I know that, the only other studies that I'm aware of locally that did something that was looking at qualitative data and doing interviews was, I know Daystar did one looking at the experiences of women who are using the system, but I'm not aware of any other studies that are doing qualitative or quantitative, research around the LGBTQ plus community here. Maybe someone else is?
I'm aware that Family Resource did a youth study, but this was some time ago. And so they may be a resource there to connect with. Dr. Patterson, when you were interviewing the participants, was anyone using the new Wellness Connection line for mental health services?
Not that I'm aware of or that they brought up in the interview. People had talked about, is that different from 211? Because they were not talking about that. Is that part of the You Good campaign? I'm actually not sure, because people didn't talk about that.
It is not the 211 line. It's a 791-3131 line.
Okay, nobody mentioned that in the interviews that I talked to.
Okay. Amy, we have one more question regarding COC services. And are there assistance and supportive services for homeless sex offenders?
That's a great question. It actually came up on a call yesterday. And I would say this is one of the barriers that we need to continue to remove in the continuum of care. Many providers have challenges around this particular barrier as it relates to their own insurance policies or board policies that have been put in place. There certainly isn't a family shelter where a sex offender would be allowed. Most of our family shelters are doing some kind of background check which is not housing first, but certainly you can understand the reasoning for that. But Safe Harbor is the only shelter for individuals that would not require any kind of background screening in order to get into it. St. Vincent de Paul is also a low barrier individual shelter, but we certainly have some work to do as it relates to barriers for family shelter in general. But certainly there's safety concerns around why those things are in place.
Thank you. And we did get confirmation in the chat that the number is for the You Good. That is the You Good line, and it is in the chat.
One other challenge I just want to mention that someone reminded me of, though, is that Safe Harbor, even though they are allowed there, they have to leave because it's built right next to a school. So they are not allowed to stay there long term. And that is an additional barrier that I didn't mention earlier. Thanks, Charlie, for bringing that up.
We have one more question, and this could be for anyone. Is there a local study on relationship between homelessness and suicides?
I'm personally not aware of any. I don't know if others are.
I know that I am not aware either. So that could be another point, another great takeaway of need for research. We've got an excellent question here. And again, I'm going to open this up probably for Amy. Previously being homeless, I was not aware of help from services. How can we better equip the homeless population with the information needed to know that there is help in their community?
Denise, that's such a great question. Right now, we're working on redesigning the entire system and more importantly, the front door and coordinated entry. And this is one of the areas we've identified as a concern, that it might be the best kept secret, and it shouldn't be, right? It should be easily accessible. Everybody in our community knows where they would go when they need assistance and how they access those services. And then if there are multiple access points, those access points would be coordinated in some way. So right now in our community, the access points into the homeless system is 211. There's a homeless helpline there. Also street outreach, if you're found living homeless on the street in your car in an encampment, they would be a point of access as well. And then we have a number of school programs that would also be an entry point into the system. But we don't have that well advertised in our community. And once we are done redesigning what that front door looks like, that's one of the things we really have to do some campaigning around, so that everybody knows, whether it's your faith leader or a civic organization, everybody in our community knows what to do and where to reach out when they need assistance.
Thank you. April Lott from Directions for Living posted in regards to the question about the suicide study is that Directions has a comprehensive study on death by suicide in the Tampa Bay area. It's not specific to homelessness, but they do have that study. Dominique Randall posted a resource on a suicide fact sheet for everyone. And Ann Richter stated that she posted the PinellasWellnessConnection.org website. Oh, Baycare did the study. Thank you, April. So are there any further questions?
I'll just mention to Avery that we do print a resource. There's a very small guide called the Homeless Resource Guide that, it's about this big, so it fits in people's back pockets. Those are available to anyone in the community free of charge. And Dominique has put that link in the chat. So we'll make sure when we follow up that we provide the link to that to everybody as a part of the follow-up to this presentation today as well, so they have that.
Thank you, Amy. Well, at this time, I see no further questions, so I want to thank everybody for that. And again, we will be posting these on the website. So with that, I want to bring back Amy, and she's going to tell us about our next section with the small group discussions.
Thanks,
Amy?
Avery. So next you're going to be going into the group. If you joined us at the very beginning of today's session, you were able to select the priority that you wanted to work on. For those of you who had to join later because we had a capacity issue, we've put you into a group so that we didn't have a chance to get that information from you. If for some reason you aren't put into a group, just stay in the large room and a host will assist you and help assign you at that time. So you're going to go into your small group discussions, and you have 4 priorities while you're in there. You're going to select a recorder or reporter. You will have a facilitator who will be taking notes in the session for you. You're going to do a quick introduction of yourselves, then discuss why you chose that priority, why you think it's the highest priority for the continuum of care to work on. And then you're going to create 3 action steps related to that priority that you think the COC should work on. So I mentioned earlier that you're helping us set the priorities so that we're not doing this in a vacuum. And this is what we're hoping you're going to help with in your small groups. You'll then come back to the large group and we'll do large group report out and have some additional discussion before the end of today. I think you're muted, Avery.
Thank you so much, Amy. And with that, I'm going to turn it over to Carmen, who has been working in the background, and she's going to get us ready to go into your small groups.
So everyone will get automatically moved into their groups. If there are any tech issues, just please come back to the main room or stay in the main room and we will assist you. Thank you, everyone. And here we go. Hi, May. Hi, Dawn. Do you all need help moving into a breakout room? Just go ahead and unmute yourselves and let me know. May. Dawn, do you need assistance moving into a breakout room? Unmute and let him know. Okay, Lori, do you need assistance moving into a breakout room? Okay. Just unmute yourself. Is your volume up?
It appears Dawn may have stepped away.
Make sure Dawn. Okay. Hi, Gregory.
Yeah, hey, I signed up for the employment one, so can I get put in that room?
Yes, give me one moment.
Thank you.
Hi, Earl. You need placed in a room?
Yeah, I'm sorry. I actually am at a dealership in a public space, so I'm going to mute myself.
Okay, that's fine. Which room do you want to go into?
I don't know, I'm just joining the meeting a little late, so put me anywhere that's appropriate.
Okay.
Okay, give me 1 second, Arlo. I'll find you a good one. Go ahead and move you into rooms. Give me 1 second, Arlo.
Hi, Sam. Welcome back.
Hi, Sam. Can we help
You
you?
know which,
Breakout room?
I just joined the meeting, so I'm ready to be wherever.
Okay, perfect. I'm gonna put you with Carl Lavender.
oh
Okay,
yeah,
thanks.
that's a great one for him to go into.
Perfect.
That's a perfect room.
There you go. Yeah, Dawn just got some joiners. Okay, so it looks like everyone else is in their rooms. We had a little hiccup, but that's okay.
That's all right.
It's all fine.
We're good. We're good. I don't think anybody but the people that were trying to get in saw the hiccup.
Yes. No.
And I've been doing the count. We've got, I mean, I know at one count we had 118 with us.
Yes. Yeah, I think so. So what I'm gonna do now is take a snip picture of each of the breakout rooms.
Okay.
Unfortunately, I wanted to give you like a spreadsheet of all the names, but we just had so many people who weren't there for the poll.
Yeah, that's fine. Just go ahead and we'll just do that. Is there anything that you need me to be doing during this time or just stay here?
Just stay here. I mean, we're just gonna be here in case anyone asks for any assistance. So we'll just stay on for that. We have got, so always with breakout rooms that's happening, I'm saying this for you and for Harold, we always have people who we're like, we're gonna go in breakout rooms now. And they're like, and that's my cue to leave.
Yes,
So no matter
absolutely.
how, I think there's one room that has just 2 people in it.
Okay.
So some of them will look a little bit leaner than others.
Mhm.
But that's just because people come and go. Hi,
Right.
Dawn, can we help you find a room?
Erica and Kristen are here.
Erica, can we help you find a room?
Yes, I was disconnected and I reconnected by my computer, so I'm sorry. What are the rooms? If you could just refresh me real quick.
I can put you, we actually have one room that only has a few people in it. If you wouldn't mind going into the lived experience room.
Sure, that'd be great. Thank you.
Perfect. Give me 1 second. Dawn, are you able to hear me?
Mhm.
Dawn, are you able to hear me? Okay. See if that works. Let me actually keep moving Dawn into a room and keeps coming back. Dawn, are you able to hear me? We're trying to move you into a breakout room. Okay, so I'm going to take a picture of the breakout rooms as they stand right now.
Okay.
Yeah, so I just go to snip and then I
Yep.
take a picture each time. And then I save it and just name it as like BR 1 through 4. Yeah, I already did that. 4. I'll just scroll down because you can't get it all. And for some reason, Zoom doesn't give you a report of your breakout rooms, which I find
does.
strange.
That's very strange.
Like, make it a lot easier if you could just do a report, because people have asked us before, can you let us know who is in the breakout rooms? And sometimes they ask after,
Right.
and I can't. Hello, Tony. Do you need a breakout room?
I do. I thought I had signed up for the workforce development room.
Okay.
So if you can slide me in there, I know I'm going to be late to the party, so I'll stay in the background, but if you could move me there, I'd appreciate it.
Yeah, and that's the jobs one, Avery, correct? The workforce-
Yes, it is.
That one is number 4. That one is quite popular. Where is it?
Thank
Yes,
you.
but I'm looking at it and it's good.
Where to go here? So yeah, you have to find the person and then click move them. If, yeah, because you'll see that you're still in here where it says not joined. So because I've already put you in, put you back where you were, if someone comes in new, it'll say not assigned because they didn't have one. It's also important to save. I'm gonna go ahead and save the chat now,
Okay,
just in case it doesn't auto save.
thank you.
And if we can still point back to some of that.
Okay, great. Yeah, I think I captured all of the questions, but I want to make sure I do just so I have them.
Yeah. Go ahead and